an original.
From Story Studio Network.
Welcome to The Fatigue Fixer, the podcast where we get real about why you're so tired and what you can do about it. Every 2 weeks, we'll gather here for honest, heart-to-heart conversations about reclaiming your energy, your patience, and feeling truly at home in your body. I'm Dr. Sarah Vadeboncoeur, a naturopathic doctor, Menopause Society certified practitioner, Enneagram 3 entrepreneur with enough business ideas to last me 10 lifetimes, and a hockey and baseball mom. Over the past 15 years, I've helped thousands of women just like you cut through the confusion and finally feel like themselves again. And now, I want to hear from you too. Use the link in the show notes below to leave me a voicemail, to share your story, give feedback on an episode, ask a question, or tell me what's been exhausting you. And your voice might even make it onto the show. Together, we'll get to the root of what's really draining your energy and give you the tools, clarity, and encouragement you need to fix your fatigue. I hope you enjoy today's episode. Picture this. You're sitting on the couch at the end of a long day. The kids are finally asleep. You're so happy to be able to finally just sit down and enjoy some quiet time, watching Netflix or maybe scrolling or both. When out of the corner of your eye, you notice your husband or significant other giving you the look. You know, that look. The look that means, I'm hoping we're going to have sex tonight. Your stomach drops. You are not in the mood, like not at all in the mood. And you're not alone. No matter how old you are listening to this, there is a 40 to 50% chance that you are experiencing at least one sexual symptom, such as low desire, poor arousal, or pain with sex. And those numbers peak during perimenopause and postmenopause. And while not everyone is bothered by not wanting to have sex, I know that a lot of you are, because I ask you about it in my office. And you tell me your libido is missing in action, nowhere to be found, and it's putting strain on your relationship. This is the one where sex is the last thing on your mind, and we're exploring why so many women experience low sexual desire, the role that both your brain and your hormones play, as well as if the hormone du jour, testosterone, might be to blame. You're going to walk away better understanding desire, because our expectations of how and what desire look like are often a huge part of the problem. The 3 things that can get in the way of a pleasurable and satisfying sexual experience, and what you can do when you get that look from your significant other. Because in that moment, it's not just that you're tired. There are dozens of factors your brain is taking into consideration as it's deciding whether to go for it or fake a sudden headache. So let's start by looking at some of the factors that influence your libido. And for that, we're going to come back to something called the biopsychosocial model, which I introduced to you in episode 28, which was the one where you don't feel like yourself, where we looked at the mood changes that many women experience in perimenopause. So if we look at sex through that model, we can start with the bio, which stands for biology. And these are basically all the different biological factors that impact sex. That includes what's happening hormonally, right? If you have a cycle, where are you in your cycle? Are you ovulating? Are you about to get your period and you have raging PMS? Because a lot of women notice that their desire for sex really fluctuates throughout their menstrual cycle, often peaking around ovulation and then really dipping in the luteal phase in the week or so before they bleed. Maybe you recently had a baby, or you're still nursing. Maybe you are going through perimenopause. Maybe you've had a hysterectomy or some other surgery that's affecting your overall health. Or maybe you have chronic pain. Maybe it's back pain or other chronic pain. So certain positions don't feel good for your body. Maybe you're on medications that affect libido, like some antidepressants. So all of the things that are happening inside your body are going to affect whether or not you want to have sex and what that sexual experience will be like for you. Then we move on to the psycho component or psychological component. This includes what's going on with your mood, right? Are you tired and overwhelmed from taking care of everybody? Maybe you're dealing with anxiety, depression, trauma, or PTSD. Maybe you have some performance anxiety because you feel like you're supposed to look, act, and sound a certain way during sex. Maybe your body image isn't great right now, right? Maybe you're trying to hide yourself under the covers or suck in your tummy and stop things from jiggling so much. All of the things that are going through your mind and that affect your mood have a huge impact on whether or not you're going to desire sex. Then we look at the social component. What did you learn growing up? Did your parents talk about sex, or it was the forbidden conversation that no one was going to talk about, right? Maybe you grew up in a religion that preached that sex before marriage was a sin, right? What are all the different messages that society has told us about sex? Do you feel comfortable initiating sex, or you feel like that's something that your partner should be doing? Maybe you feel guilty for saying no. And for your information, marital rape was outlawed in Canada in 1983. I was 1 year old. So before that, it was assumed that it was a wife's duty to have sex with her husband, whether she wanted to or not. Now, that wasn't that long ago, and there's still a lot of women who feel that sense of duty that they should be having sex when their partner or husband wants it. And if they don't want it, they feel a lot of guilt or they feel shame because they don't want to be having sex, right? Maybe you worry that you're not sexual enough. Or maybe on the flip side, maybe you are very sexual and you're worried about being labeled a slut or a whore if you want sex too much, right? We get so many mixed messages about how sexual we should want to be or should be. And it's all very difficult to try to fit yourself in. What if you need lube? Does that mean that you're dried up and something is wrong with you? So again, think about all the messages that we have received about sex for as long as we've been alive. Those are all influencing your desire as well. And for this conversation, there's also a fourth component that we can't ignore, and that is the interpersonal component, which is about your relationship, assuming that you're in a relationship. What's your relationship dynamic like? Is this a new relationship? Or is it more of a long-term relationship? I said this to a patient recently, and we both laughed very much. And I said, when you've been staring at the same penis for 15 years, it's a little bit harder to get excited about it, right? So if you've been in a long-term relationship, your desire is likely going to be very different than it was in the first few months that you were together with that person. What is the quality and satisfaction of that relationship? So I hope you can already start to see that your libido is a lot more complex than whether or not you have enough testosterone, which I promise we will come back to. So let's start to break down what we actually mean when we're talking about libido, what can go wrong, and then what we can do to improve it. Because when we talk about libido, we are often lumping a whole bunch of different things together. And I think it's really important that we talk about the different parts of this. First up is desire. Desire is the actual wanting of sex. And we often blame our hormones for not wanting to have sex, but the most important sex organ you have is your brain. So when we talk about desire, which again is actual wanting of sex, it all starts in the brain. And for a woman to be turned on, her brain needs to be turned off. When was the last time your brain was calm and turned off? I know it's been a hot minute for me. I have to be very intentional to get my brain to turn off. So we used to think that desire was the first step to a satisfying sexual experience, right? It makes sense when you think about it, right? Before I have sex, I need to want to have sex. Well, that model is very much based on something called spontaneous desire. And that is the kind of desire that many of us have experienced, especially in the early part of a relationship, right? If you've been in that honeymoon stage, all you need is literally to see your partner, think about them, have them touch you, and you are like, I want sex, I am ready, right? Our desire for sex is so close to the surface, it really doesn't take much for it to show up. This is also the kind of desire that we see modeled on TV and movies. We often assume that that is how we're supposed to experience desire, right? We should just be able to look at our partner and want all of a sudden to be ready and willing to want to have sex. But if you're like me and you've been with the same partner for 15 years, chances are that spontaneous desire isn't coming around super often but it may be for your partner. So when they still want sex randomly on a Tuesday and you don't, you assume that there's something wrong with you. But thank goodness, a lovely woman by the name of Rosemary Basson is working and has been working to change this narrative by offering us like an alternative model of sexual motivation. So instead of following the traditional models, which are very linear, right? First comes desire, then you get aroused, then there's the plateau, then there's an orgasm and resolution. The Basson model is circular. You can enter it at any stage, but there are a few requirements. Number one, you need to have a sexual motivation, meaning you need to have a reason to have sex. Now, this is going to vary for all of us. It could be to feel closer or more connected to your partner. It could be for affection. It could be for pleasure. It could be for stress release. But if you have no motivation to have sex, you're not going to desire to have it. Number two, you need to be open. And this is something I chat with my patients about all the time. Now, being open doesn't mean that you are sitting there wanting to have sex, right? Your desire is not very high in the moment, but you're open to the possibility of sex. So it's not a hard no. You're like, I'm not really in the mood, but I could be convinced. I'm open. Number three, there has to be some kind of stimulus. Now, this could be touch. It could be taste. So maybe you're eating or drinking something. It could be other ways that you stimulate your senses. Number four is we need the right context, right? If your children can barge in at any minute, that might create a context that for you doesn't allow you to feel relaxed and able to participate in sex. And number five, your body and your mind need to be healthy. All of those boxes need to be checked to feel arousal. And then once you feel arousal, and arousal being like being turned on and starting to feel pleasure, then you experience desire. And this is what we call responsive desire. The desire or the wanting doesn't come before the turn on, it comes after, right? And this is a type of desire that is much more common for a lot of women, especially if you've been in a long-term relationship. And in this context, a long-term relationship would be more than 6 to 18 months, right? So if you are out of that early honeymoon phase, chances are you have less spontaneous, out of the blue, out of nowhere desire, and you're much more likely to have responsive desire, which doesn't show up until you feel pleasure. So if we go back to our couch scenario, right? How are all these things playing out? Well, motivation. Do you have any motivation for sex right now? Like, how many tabs are open in your mind? We are recording this the day before what we lovingly call at our house the Hunger Games, which is summer camp sign up, which happens in January, which makes me angry every year. But a lot of us have all these mental things that we are trying to keep track of, and our motivation for sex right now might not be very high on the list. Number two, are you open, right? Are you open to sex right now, or are you still super pissed at your husband for getting home late after golf, right? While you were home with the kids. Number three, stimulus. Is there anything happening that could create a turn on, or is he sitting there in a holey t-shirt and ratty underwear and hoping that that's going to turn you on? Maybe it will, maybe it won't. Context, right? What's happening around you? Are the children in bed? Are you guys in a good spot in your relationship? Maybe you just had another argument over the dishes. And then a body and mind check, right? Do you have the energy, or would you rather literally just go to bed? Maybe you feel super touched out if you have small children literally hanging off of you all day. All of these factors and more act as brakes and accelerators, right? Some of these things increase your desire and some of them shut down desire. And all of these things come together to create your level of desire, which, as you can imagine, can change day to day and month to month. And to add to all of that, this is something I think is so important to remember and to understand. That for something to be worth desiring, it has to be desirable. So in the words of Esther Perel, in order to want sex, it needs to be sex that is worth wanting, right? If the sex that you are having isn't very enjoyable and it's not really doing it for you, why in the heck would you want to have more of it? And what's super interesting is that for women to remain interested in sex, the sex needs to be interesting to her. And I saw a video of Esther Perel talking about this a few months ago, and it stopped me in my tracks because she talked about how women actually get bored with monogamy much sooner than men. And I was like, holy shit, that's crazy. Like, why? And she talked about this, that a lot of times when women get labeled as having low desire, what is actually happening is that she is not interested in the sex that is being had. She is bored with the sex that is being had, and therefore she doesn't really want to have more of it, and she gets labeled as having low desire. My mind was blown when I heard this, and it really made me think about, like, what was your last sexual encounter like? I want you to go back and think about the last time that you had sex. What was it like? Did it feel great? And afterwards you were like, oh my God, we really need to do this more often. Or were you lying there, like doing the grocery list in your head, praying for it to be over, and then basically being happy that you wouldn't have to do it again for a while? Can you predict play by play exactly what's going to happen in your sexual encounter? If so, that's pretty boring, right? That's not overly exciting for a lot of us. I want to repeat this so it really, really sinks in. In order to want to have sex, you have to be having sex worth having. If it's painful, if it's boring, or it's just not pleasurable and it's not meeting your needs, you are not going to want to do it. And there's nothing wrong with you, but like, think about how often you desire to go get your teeth cleaned. Probably not a lot, because it's not a super pleasurable experience. Versus you're probably a lot more excited when you open up your calendar and you see that you have a massage or a spa day. You're like, yeah, I want that. If having sex for you is the equivalent of getting your teeth cleaned, you are absolutely not going to want to do it. And that's not a you problem. That's the sex you're having is not creating more desire. So how do we know if low desire is a problem? This is very personal because, as I shared in the introduction, we know that up to 50% of women experience low desire and other sexual symptoms, but only about 12% of women are bothered by it. So a lot of women, and I see these women all the time, they're like, yeah, it's low. It's not a big deal. My husband's cool. It's not a problem. So if your desire is low and you are not bothered by it, wonderful. You don't need to do anything. There's no problem. There's nothing to fix. You're fine. If it's low and it doesn't bother you, wonderful. And I want to take a moment to talk about expectations, because one of the things that I realized about myself very recently is that I had this rule that I had like kind of internalized about sex, which was that if I wasn't having sex at least once a week, I wasn't having it enough. And for years, I've been like fixated on this and always felt like if I'm not having sex at least once a week, I am not having enough sex. And then finally, a few months ago, I finally had this like aha moment where I was like, where did that rule even come from? Like, where did I pick that rule up? And I realized, like a lot of different things, it's fully made up. Like, I just heard that somewhere and assumed that if I didn't meet that standard, something was wrong with me or something was wrong with my relationship. And as soon as I kind of acknowledged, like, well, that's a made up rule. I don't need to aim for that because it's made up. As soon as I let go of this like made up expectation, there was so much less pressure to just have sex because it had been a while. Because ultimately, when I think about it, my goal is I want to have sex when I desire it. And I want the sex I have to be pleasurable, whether that's once a week, once a month, 3 times a week. The timing is not as important as having it when I desire it and having it feel good. So my once a week rule, I'm letting that go because it was made up. If you are not experiencing a whole lot of that spontaneous out of the blue desire, it doesn't mean anything is wrong with you, especially if you are in a long-term monogamous relationship. Maybe the only shift that needs to happen is thinking about how you can create conditions that allow for responsive desire to show up, which again is where the pleasure comes first and then the desire, not the other way around. But what if your desire is really low and it is bothering you? This could be a sign of something called HSDD, or hypoactive sexual desire disorder, which is defined as the absence of sexual fantasies and thoughts and or desire for or receptivity to sexual activity that causes the person distress or difficulties in their relationship. Now, the distress is a really important component. So again, if you have low sexual desire and it doesn't bother you, you don't have HSDD. This is really where it is creating distress and difficulty. It has to be present for at least 6 months. And it's estimated that about 1 in 10 women have HSDD. So it's one of the most common female sexual difficulties. And it can be caused by a lot of the factors that we covered when we went through that biopsychosocial model. So some of the things that can increase your risk for HSDD are anxiety and depression, relationship problems. When we look at relationship problems, there's a couple of things that I find really interesting that we've talked about in other episodes on this show that really show up when we have this sex conversation. And one is the mental load, or the inequitable division of household labor, right? Where a lot of women are the CEOs and managers of the household and of the family. And it creates a lot of extra mental strain on women. I saw this idea of something called chore play, which is a play on the idea that like if men or partners kind of like picked up the slack in the chore department, that women might be more interested in having sex. The other thing which I find fascinating is the blurring of the mother and partner roles. Sadly, a lot of women feel like their partner is another child that they have to take care of. And mothers, as you can imagine, if you are one, mothers are not sexual towards those that they mother. If the dynamic in your relationship is one where you feel like you are mothering and taking care of your significant other, you are not going to want to have sex with that person. And if you follow me on Instagram, last week I posted this video about this male dentist. And he was saying how it's shocking how often men show up in his office and have no idea why they're there. And he's like, these men should be more ashamed and embarrassed, and they're not. Basically what happens is their wife books them in and they show up because it was on the calendar and they have no idea why they're there. And that it was just like one small example of the way that we often mother our partners by booking their medical appointments for them because we think, well, if I don't book it, he won't get his teeth cleaned. Well, he's a grown adult. He can figure out his own dental cleanings. But it was such like a poignant example of how just one small way that this shows up. All the things that happen in your relationship, all these things add up, can have a huge impact on your desire. Next up are issues with body image. And this is where we see the role of the objectification of women, the beauty standards, all of the standards that a lot of us have and continue to try to fit into, which is impossible because they're unrealistic and ever-changing. So what's interesting is that the closer a woman feels to the desired beauty standard, the more desired she feels, and therefore she feels more desire. A different way to say that, women who look closer to what is desirable in terms of beauty standards have higher levels of desire because they themselves feel more desired, which is interesting. So the flip side of that could be, if you feel like you don't fit the beauty standard at all and you don't feel desired, you're not going to have high levels of desire. Stress plays into this, tiredness, if there's any history of sexual abuse or trauma, low sex hormone levels, which I promise we will talk about testosterone soon, medical problems, things like cancer, diabetes, heart problems, bladder problems, and then medications. So there are medications like certain antidepressants, the oral birth control pill, blood pressure medications, and chemotherapy and other cancer drugs that can definitely impact your desire. Now, I want to be very clear because a lot of women are on antidepressants. This is not a good reason to just obviously come off your medications, because when we look at women who have major depressive disorder and who are unmedicated, 82% of those women experience sexual dysfunction, including low desire, poor arousal, lack of lubrication, poor orgasm, and poor satisfaction. This is really tricky because the depression itself can cause some of these issues. And then the treatments we give women for depression, antidepressants, especially the SSRIs, which are the biggest common kind of type of medication, those can also cause sexual side effects. And those really range from like 4 to 80%. If you're on an antidepressant and you're dealing with low libido that's causing frustration or distress, that's a really important conversation to have with your family doctor. Is there a different type of medication that I could take which might reduce some of these side effects? Menopause can contribute, and then recently being pregnant, giving birth, or breastfeeding. So we just spent, how many minutes was that? Like probably almost 20 minutes talking about all the factors that influence when you're sitting on that couch getting the look, how will you respond? And what will influence your level of wanting or desire, right? So again, your brain is thinking about all of these different things as it's making that decision like, do I want to? Yes, no, I don't know. It's a complex decision-making process. Are you tired of being told everything is normal, even though you're exhausted and don't feel like yourself? You deserve better care than that. In my one-on-one practice, I help women just like you do a deep dive to figure out what's really draining your energy. Together, we'll get answers and create a clear, personalized plan to help you start feeling like yourself again. If you live in Ontario or the Outaouais region and you're ready for the next step, visit drsarahv.ca to learn more and book your appointment today. Because being tired all the time isn't normal, and you don't have to keep pushing through it. Now, assuming that we are open to a sexual encounter, the next part is that we need to be aroused, right? We need to get turned on. So let's talk about arousal. Your ability to be aroused is also very dependent on your brain. And especially if you are not present and relaxed, it's a lot harder to get aroused. But this is also where we start to have lots of physical arousal as well. So a big part of what's happening when you start to get a stimulus, whether again that's touch, whether that's food or words or watching something, you start to get increased blood flow to the genitals, which causes something called vasocongestion, so more blood flow and kind of swelling of those tissues. This is where we'll start to see an increase in vaginal lubrication. And your vagina, our vaginas are so amazing. So your vagina prepares, assuming that you're having sex with someone with a penis. But even if you're not, when you get aroused, your vagina lengthens and it dilates. So a non-aroused vagina on average is about 3.5 inches. And when it gets aroused, it opens up to 4 to 7 inches. If you have deep pain during sex, it might be that you are not fully aroused and you need more foreplay to allow for that lengthening and dilating to happen. And because I know everyone's wondering, the average aroused penis is about 5.1 inches. And if you are wondering, these are absolutely the kinds of fun facts that I was sharing with my partner last night while we were making dinner. And he's like, okay. He's like, what are you trying to tell me? I'm like, I'm not trying to tell you anything. I'm just sharing some interesting facts. So if you are not getting aroused or you're noticing that it's harder or it takes longer to get adequate vaginal lubrication, there are several things that could be playing into that. So menopause is another one that really increases the risk of having vaginal dryness. Again, if you are postpartum or breastfeeding, I will never forget when my son was born, he punched me. He came out and punched me pretty much near my clitoris, and I had to get stitches. And I remember after they stitched me up, which I was terrified of, but was actually not terrible. I remember them saying like, okay, so you can't have sex for 6 weeks. And I remember looking at them. I'm like, if anyone tries to come near me, I'm going to punch them. Like, don't worry. I'm not planning on having sex. And just so you know, that rule is 100% made up. It takes a year for your body to heal after you have a baby. So if you don't magically want to have sex and your vagina does not feel ready to have anyone come near it, again, there's nothing wrong with you. And because of the hormone changes, and again, a lot of the societal stuff, like some women may not feel as sexual or may feel it's harder to express their sexuality in the same way after they have kids. If you had POI, premature ovarian insufficiency, which is the end of the period before the age of 40. For all my allergy-prone ladies, antihistamines and decongestants, they don't just dry out your nose, they can dry out your vagina too. We've talked about antidepressants, especially those SSRIs, anti-estrogen therapy. So these are often given to women after they have treatment for breast cancer, chemotherapy, smoking, and I love this, intense vaginal douching. Please don't do any vaginal douching. It's really going to dry out and make your vagina unhappy. So nothing goes up there. Just rinse with water. The other thing I think is really important is that the level of wetness does not reflect your arousal. So you can be really turned on and be dry. And I think this is really important for us because, again, a lot of times we feel bad or embarrassed, like, oh my God, he's going to think I'm not turned on or she's going to think I'm not turned on. No, the wetness and the arousal are not always connected. If we go back to some of the questions we asked before, right? You got the look, you decided, okay, I'm open, not super into it, but I'm open. And now you're kind of in it and you're not feeling aroused. You're not really feeling turned on. I want you to go back to, are we doing the kind of things that I like? Are we having the kind of sex that turns me on? Is there enough lead up and foreplay? Maybe your body is aroused, but your mind is still off, like at the grocery store making a list, so you're not actually present. And maybe the sex is kind of like same old. Like I can predict this play by play. I'm not really turned on here. And then hopefully we get aroused. And last but not least, hopefully we have an orgasm or 2 or 3 or however many you want to have. So let's talk about orgasms. So hormones are important here. And I want you to notice how hormones have not been dominating this conversation, because if you go online right now, there is this hyper fixation and focus on testosterone. And some people are giving the impression that like your sex life isn't what you want it to be. Just slap on some testosterone. It's going to be great. And testosterone can help with certain parts, which again, we'll talk about. But testosterone is not going to fix your shitty relationship, right? It's not going to undo your stressful life. It's not going to help your children sleep through the night and give you more energy. Testosterone is important, but again, it's one piece of the conversation. When we look at the ability to orgasm, this is again where hormones are quite important. And we know that hormone changes can cause more vaginal dryness and symptoms of GSM, which stands for the genitourinary syndrome of menopause. And recent studies report that up to 84% of women post-menopause have one or more symptom of GSM. And what's fascinating is that when we actually look and examine them, it's actually 90%, which means that some women have symptoms and they don't even know about it. One of the things that happens as you go through your menopause, your hormone levels drop, and especially the drop of estrogen really reduces blood flow. And when there is less blood flow, there is less lubrication and there is less sensation, which makes it harder to have an orgasm. So this is where bringing our good friend, the vibrator, can really help because it can increase blood flow, which can really help if you're struggling with orgasm. And I am very pro lube. I ask all my patients if they use lube, and if they don't, I'm like, please start using lube. Lube can be very helpful. It reduces friction, it can reduce pain, and it makes it likelier that you're going to have an orgasm. And because I'm a naturopathic doctor, I don't know, maybe this is everyone, but people love using coconut oil for all their problems, including using it as a lube. I do not recommend that. And the reason is your vagina naturally is very acidic and you want it to be very acidic. That is part of what keeps the vagina healthy. And coconut oil has a more neutral pH. So if you're using it a lot, it could potentially throw off the pH of your vagina, which is not a great thing. There's actually a whole science to lube. And sadly, most of the most popular brands can often actually worsen dryness and cause more irritation. So please go in the show notes and I'll post some helpful resources to help you pick a better lube, because the most common ones, which I will not name, are not always the best choice. And please, please, please hear this. There is nothing wrong with you if you need lube. Everyone should use it, whether you feel like you need it or not. Please use lube. And if you are lucky enough to have an orgasm, there are so many benefits to having orgasms, including stress reduction, pain relief, better sleep, better immune function, cardiovascular benefits, improved mood and well-being, and enhancing your pelvic floor strength. And I hope this has been a very partner-focused conversation. You don't need a partner to have an orgasm, so go for it and give yourself lots of orgasms. They're good for you. Okay, last but not least is pain. Obviously, if you're experiencing pain while you're having sex, it's going to make you want to have less of it. And there are lots of different reasons why someone might experience pain. So one is that GSM, again, that post-menopause change in the vagina can definitely cause pain. There's also the genitourinary syndrome of lactation, and I'm so glad we are specifically naming that. It is very normal and common if you are breastfeeding that your vagina is not going to lubricate as easily. And again, there's nothing wrong with you. It's just your hormones in your body are focused on other things. If you have pelvic floor dysfunction, including something called vaginismus, which is where the vagina literally tightens because it's expecting things to be painful. If you have any scars, maybe your child also punched you on the way out from surgery or childbirth, skin conditions, so lichen sclerosis or yeast infections, or you just don't have enough lubrication. So I did a fantastic episode about pain with intercourse, as well as a lot of bladder issues with Lisa Flanders, who's an amazing pelvic floor physio. So you can go back and listen to that one. That's probably one of our most popular episodes that I link back to all the time, which is episode 15, the one where sex hurts and you pee all the time. If you have heard all this and you're like, okay, Sarah, but what do I do? Why is my I understand now why my libido is low. What the heck can I do about it? Number one, exercise. There is nothing that exercise doesn't help with, and this is another example. People who are more active are less likely to have a lot of these symptoms. So if that encourages you to go for your walk and lift some weights, go for it. Hormones can be helpful. The first one to talk about is local or vaginal estrogen. This is an estrogen, usually a gel or a little ovule insert that goes in or on the vagina. And it is just staying local. It's not treating your hot flashes and night sweats. It's literally just treating the vagina and the bladder. This is extremely helpful for increasing blood flow. It can help with lubrication and sensation. This is something I prescribe all the time to my patients because, again, 80% of women post-menopause have symptoms. We want to treat this because this is one of the symptoms that does not get better with time. It actually gets worse. So don't wait until your vagina feels really unhappy. If you have even mild dryness and you're in and around menopause, local estrogen is safe for literally everybody and extremely helpful. Now, what it will not do is increase your sexual interest. So if you put estrogen in your vagina will be happier. So sex might feel nicer and you'll be more likely to have orgasm and arousal. It will not change your desire because, again, desire is happening mostly in the brain. When we look at systemic hormone therapy, so meaning estrogen that we give usually through the skin that is going into your whole body, having low sexual desire on its own, if that's your only symptom, it's not an indicated reason to take systemic hormones. But if you're having sleep issues and mood issues and hot flashes and night sweats, hormones can really help treat those and indirectly could help improve your sexual desire. Because again, if you're getting more sleep and your mood's better and you feel better, more likely that libido is going to get better. We do see that systemic estrogen works best for libido specifically in women who have other symptoms and who are within 5 years of their last menstrual period. And we ideally want to be using transdermal estrogen, meaning, again, estrogen that you put on your skin. When we take estrogen by mouth, we often are actually going to reduce the amount of testosterone that's available. Hormones can help. The vaginal hormones help with the pleasure and the arousal. The systemic hormones help you just feel better overall, which can indirectly help. But estrogen is not a magic solution for low libido. Okay, testosterone. This was one of the big motivations for doing this episode because everyone is asking me about testosterone. So let's talk about it. First of all, I think it's really important to know that women actually have more testosterone than estrogen. We have this idea that testosterone is a male hormone and estrogen is a female hormone. It's not true. We actually have way more testosterone than estrogen. We just have way more estrogen than males do. When we look at what happens with testosterone, your levels do decline between ages about 40 to 59, and then they start to go up again. So if you have maybe a grandma or some older lady that you know who's got some whiskers and chin hairs, this is in part why, is that our testosterone actually goes up after the age of 60. Again, contrary to the internet, there is no significant decline of testosterone with menopause, right? But you're getting older through menopause. So the drop we see over the menopause transition is really more age-related. It's not specifically due to menopause. It is important to know that there are no government-approved testosterone products for women in any single country in the entire world except for Australia. So when we are taking testosterone, we give women testosterone, we're basically giving them a teeny tiny dose of a product that is approved for men. And testosterone does help. It can help with that HSDD, that hypoactive sexual desire disorder, especially for women who are post-menopause, so who are done their periods. In those women, we see about half of them, so about 50 to 60% see an improvement in their desire. And what that translates to on average is one additional satisfying sexual event per month. Now, for some people, that might be a huge thing that they want. And for other people, they might be like, one extra event per month, like that's not good enough for me to want to consider this. So testosterone can be helpful for some women. It is not a magic pill for everybody. And again, I hope you are picking up on what I am laying down, which is this is way more complicated than just how much testosterone you have in your body. And again, when we look at premenopausal women, it's not as clear what the benefits are of testosterone. We have a little bit of research, but we need a whole lot more. So if you're listening to this and you're thinking, should I get my testosterone levels tested? The answer is probably no, but I'll share with you who would want to get them tested. The reason it's not helpful to get your testosterone levels checked is that the normal range for women is extremely small. And it includes 0. Like it's basically as long as you're below 2 of total testosterone is considered normal. And the problem with testing is that the levels don't correspond with symptoms, meaning we don't know if your level is below this number, then definitely your low desire is due to testosterone. So the levels don't match up with the symptoms. The 3 reasons why we would consider checking your testosterone is if we have decided that you want to take testosterone, we want to check your levels before just to make sure you don't already have too much. If you are on testosterone therapy, you should be having your blood levels tested to make sure your dose is okay. And then the other reason would be if we actually suspect that you have high levels of testosterone, which is very common in women with PCOS or polycystic ovarian syndrome, and could also show up for women who have like acne, excessive facial or body hair, head hair loss. Those can all be due to high testosterone. So those are the times where we might consider checking testosterone. Now, there are some other medications that could help treat the low desire. One that was fairly recently approved is Addyi. This is for premenopausal women with hyposexual desire disorder. About 50% of women saw improvements in the trial. The other one is Wellbutrin or bupropion, and this could be potentially a good option for patients who are on an SSRI antidepressant and who are having side effects related to low libido. You could chat with your doctor about whether switching to a different type of antidepressant like Wellbutrin could be helpful. But please remember, I said this earlier, this is not a sign to stop your medication because, again, untreated depression, 80% of people with untreated depression also have low desire. We know that CBT or cognitive behavioral therapy can be very helpful, especially if a big part of what's going on is a mood concern like anxiety or depression or high levels of stress. And then there are some supplements which can be helpful, especially there's some that I use if it is for libido, low libido that was as a side effect of an antidepressant. There are some supplements that can help with that, or if it's postmenopause. What I hope you are taking away from today's conversation, number one, is that low libido or low desire is very common. Again, 40 to 50% of women of all ages, and higher if you're in that perimenopause to early postmenopause transition. If it doesn't bother you, please try not to stress about it. It is okay if you have low desire and it's not a problem for you and it's not a problem in your partnership. Again, I had this imagined rule, and maybe you have something like that if we're not having sex X amount of times, there's something wrong with us. There's nothing wrong with you. As long as you're both happy, please just move along. If it is causing distress or tension and you're not happy about it, I really want you to remember the difference between responsive and spontaneous desire. Most of us are not going to be super into it on a random Tuesday watching Netflix. But what are some of the things that you can chat with your partner about to help improve your motivation, your openness, the context, the stimulus, and just help yourself be healthier overall in body and mind? And if you do meet the criteria for HSDD, please speak to your practitioner about which factors could be contributing. So this is a great time to do a medication review with your pharmacist or your family doc, seeing if you are a good candidate for testosterone therapy, getting regular therapy, either alone or with a partner, and also stop mothering your partner. If you are booking their appointments or doing other things that they are fully capable, maybe just get them to book their own damn dental appointments so that you don't feel like you're taking care of them. Next time you are just casually chilling on your couch and you get the look, I hope you'll feel less guilt and shame if you're just not up for it. And if you are up for it, you are now better equipped to have better sex that leaves you wanting more. Thanks for listening. We'll see you back here in 2 weeks. I know your time is precious, so it means so much to me that you're here. If you enjoyed this episode, share it with a woman in your life who could use a little extra energy and encouragement today. It's a small way to show her you care, because we're all in this together. Wondering what the next step is? Find out what's really draining your energy by taking my fatigue fingerprint quiz at fatiguefixer.ca/quiz. You'll discover which of the 5 most common types of fatigue you're dealing with, like frazzled fatigue, where your body's exhausted but your mind won't turn off, or drained fatigue, where no amount of sleep ever feels like enough. Your results will include recommended labs to ask your doctor about, plus my top suggestions for habits and practices that can help you start feeling more rested, calm, and in control. Because here's the thing, being tired all the time isn't normal, and you deserve to feel like yourself again. And hey, if you've got a story to share, a question, or just something on your mind, leave me a voicemail. Your voice might even make it into a future episode. Thanks again for listening, and remember, it's not all in your head. I believe you, and we'll figure this out together. I'll see you right back here in 2 weeks.
This is SSN.
Story Studio Network.